My name is Suneil Jain. I'm a professor of clinical oncology at Queen's University Belfast and a consultant clinical oncologist at the Northern Ireland Cancer Centre in Belfast. I think one thing I would say to patients is there are many treatments available for prostate cancer. Many of these treatments are very well tolerated and they're also very effective. With progress and innovations and new treatments, the average life expectancy for a man with metastatic prostate cancer is in the order of 7 years. And many men will live for much longer. And I think initially when people get diagnosed, they often don't appreciate that. Another thing I would say is some people, when they go into the consultation, they have a lot of things that they want to ask, but then it all goes out of their head. So consider writing a little list of questions that you can ask. It just means that everything gets answered during the consultation. Well, I believe that shared decision-making is a very important part of working with patients who've been diagnosed with cancer. And this is a process that we're very good at in the UK, where oncologists and nurses and healthcare professionals who are experts in the management of prostate cancer work with patients and their relatives who are experts in the individual patient that we are treating. Because it's very important that I understand what your values are, your priorities are, what your fears and concerns are. And then we work together to make a plan of action. So I'm a big believer in patients educating themselves on their diagnosis and their condition, because I think it helps them to be involved in the decisions for how best to treat their cancer. I find that the Prostate Cancer UK website is excellent. There are a lot of patient information sheets that explain in very clear terms treatments such as radiotherapy or drug therapies like chemotherapy, what the treatment is, how it works, and what the potential side effects are. And my patients have found that a very useful source of information. So I think you pick reputable sources, your team can advise you on that and really stick to those for education. It's very important that patients are aware that our job is to treat you to the best of our abilities. We want you to be as well as possible. We want you to tolerate your treatment with as few side effects as possible. You know, there are many drug therapies available that can alleviate side effects, for instance, nausea. And there's other things that can be done. Sometimes we can reduce the dose of treatment or change the type of cancer treatment. So I would encourage patients to reach out and tell us if there is something that's concerning them, if they're not feeling well, if they're having side effects. Because actually, quite often we can deal with it early and prevent it growing into something more significant. It is very important that patients stay as active as they feel able to as they go through their cancer treatment. That makes patients feel better as well, because some of these treatments that we use for prostate cancer patients can gain weight. Exercise really helps with that. A good healthy diet really helps with that. But patients also feel better. They have more energy. They enjoy life more as well. I would highlight the role of the nurse specialists. A lot of patients are just more comfortable lifting the phone to call the nurse specialist, and they can express any concerns, side effects. The nurse specialists are excellent at signposting patients, so if they can't help, they probably will know somebody that can help, and they can arrange a referral or link that patient up to the person that can help them. Every question is a good question because it's helping that patient learn about their diagnosis, about their treatment. So absolutely, there are no silly questions. I have found Sciensus a really great organisation to work with, and I think it's been very beneficial for my patients. Because our outcomes have got so good for prostate cancer, patients with advanced disease can live for many years, and they may require a number of different drug therapies during that time. And in Northern Ireland, we have a large rural population. So instead of the patients having to travel to Belfast to have their blood tests taken, Sciensus goes to the patient. And my feedback from my patients is that has been enormously beneficial for their cancer journey. The fact that a nurse comes to them, a nurse that they know, that they have a relationship with, who tests their blood pressure, does their blood tests, and then a few days later comes back and gives them their treatment. They love that, you know, and obviously if they need to be seen in person, we get them up and we see them. But for most of these men, they're actually very well. Their quality of life is very good. A lot of the treatments, the side effects aren't too bad actually in prostate cancer. And so being at home makes it much easier for them. They don't lose a whole day traveling up to see the oncology team. The team comes to them.